Hello, my name is Tamika Autry. I am a senior at Post University in Connecticut, and I am studying my bachelor's in human services. Um, I began my education at Vance County Early College High School, where I completed my associate in arts and high school diploma in 2016. I continue on my education at North Carolina Central University under the pre med program. As a new parent, I struggled with time management and being able to travel back and forth to the campus. So I ended up dropping out and taking a 1 year break from school. In the midst of that time, I became certified as a peer support specialist for the state of North Carolina. As a peer support specialist, I work with people who are having challenges in their lives, from symptoms associated with mental health diagnosis, substance abuse, or just troubling with independent living skills. So on a daily basis, we are meeting clients in the community and inside of facilities, jails, hospitals, independent living homes, where we are trying to help clients better manage their daily routines, use coping skills and wellness tools, as well as become familiar with their diagnosis and getting on track with whatever medications that they have been prescribed by their doctors. We are also helping clients get linked to mental health facilities and behavioral health programs where they are able to get the continuous help that they need to gain control of their lives. As a senior at Post University, I am enrolled in seminar in human services in my second to last module. In this course, we have been working on a research paper that is about a topic that's very important to us and important to the human service professionals in our field. So what I've decided to do is to shed some light and bring some awareness to a topic that's not really discussed and what seems to be overlooked and underreported in this field, which seems to be elderly abuse. In previous modules, we have learned that abuse can take place in many forms. Abuse can have very troubling effects on families and children development. Children can be abused, but we don't really hear a lot of people talking about elderly abuse. So my topic basically brings awareness to the types of abuse, who is vulnerable for abuse, what to do when abuse is suspected, and our role as human service professionals in the prevention and education of elderly abuse. Since elderly abuse is underreported, it's safe to infer that a lot of people are not aware of what abuse looks like or what type of abuse can take place. A lot of people are not even aware of who is capable of abusing the elderly adults, and I just wanted to take some time to gain knowledge and pull research from different sources to kind of explain the importance of being able to prevent and identify elderly abuse. So, guys, did you know that there are many types and forms of abuse when it comes to elderly people? Some people tend to think that when we say abuse, we mean physical bruises, bumps, marks, but this is not always the case, guys. And it's important to know that there are various types of abuse other than physical abuse that our elderly clients are undergoing in different settings, in their homes, in assisted living homes, everywhere. Elderly adults are vulnerable for different abuse. Okay, so one type of abuse is physical abuse. Physical abuse can take place from different other residents, family members, and caregivers that are supposed to be responsible for caring for elderly. So there are different different things that may cause physical abuse to take place. As I've said before, elderly clients are very dependent on others for their well-being. Some elderly clients are also going through mental and physical challenges in their lives that are causing them to act in aggressive ways. So we see that some clients are aggressive towards caregivers, which cause caregivers to maybe behave or respond in negative ways. This is physical abuse. We have some family members that are abusing elderly clients or elderly citizens, and this could come from a various amount of things. Research has shown that caregivers can become so overwhelmed with protecting their elderly family that they begin to become abusive, or the job of caring for the elderly family member becomes overwhelming, that they feel that they have to physically put their hands on the elderly person. There's sexual abuse. Some elderly clients are sexually abused. This could come from others who are living in facilities with them. Again, family members, even caretakers can be sexually abusing clients. Now, this could be exposing them to pornography without them wanting to watch this. This could be touching them inappropriately, or making two elderly people engage in something that they are not voluntarily doing. So elderlies are at risk for sexual abuse. In addition, there is emotional abuse. We have to realize that elderly clients have been living life in ways that they are not used to. They're not socially engaging. Sometimes they're not, interacting in the community. Some of those relationships that they used to have are no longer. So it's important to understand that the psychological effects of yelling and not providing the elderly client the necessary engagements that they need in their day-to-day life to just simply feel good about themselves. This is neglect and this is abuse. Isolating the elderly clients from the community or their fellow people and relationships, this is a form of abuse, and it can take a toll on the elderly client psychologically, emotionally, needing those supports in their life that they are not getting. This is abuse, and it is unacceptable. Another form of abuse is financial abuse. We see it all the time where elderly people may have funds or money that they are not in control of because they are not able to be. This allows room for people to come in, family members or anybody that's dealing with the client on a daily basis. This allows them the time to use and exploit the elderly client for financial gains. This is happening all the time. We actually see that financial abuse is also happening over telephones. The elderly community are also easy targets for people to call to scam them for their money. This is abuse, guys. Lastly, another form of abuse that doesn't even have to include a perpetrator is self-neglect. We see that elderly people sometimes self-neglect. Now, this means that the elderly person may be able to care for themselves, but they are not. So this means neglecting to avoiding bathing, avoiding tending to their hygiene, avoiding taking their prescriptions or anything that's mandatory for them to maintain self-care and wellness. They are not doing. So not only are other people able to abuse the elderly adults are also able to abuse themselves. So with that being said, it's very, very important that as human service professionals that we step in to intervene and prevent elderly abuse that can take place in whichever form. So, as I've previously mentioned, elderly abuse goes without being reported. So, there's dozens, hundreds of cases that we aren't even aware of yearly because we may not know that it's occurring. The elderly that's being abused may not even know that it's occurring, and these things just happen so privately that it tend to be swept under the rug. As a human service professional, it's very important to me that we begin to educate the community, we begin to educate the caregivers, and we are also staying educated and trained ourselves as professionals that we are able to intervene, detect, and prevent elderly abuse from happening in our communities. I think that it is, I think that being aware of elderly abuse will affect human services in a number of ways. Whereas when we are educated and have plans in place, we are able to safely intervene in hopes that we prevent the abuse from happening or reoccurring. Without the proper knowledge and awareness and screening tools available for elderly abuse, I'm worried that elderly abuse will continue to happen. Researchers have shown that as the elderly population grows, elderly abuse can only continue happening and increasing. Research also has linked elderly abuse in many forms to premature death. We cannot continue to allow abuse to end the lives of our elderly citizens. And as human service professionals, it is very important that we are advocating and standing up for social justice for elderly citizens. And as a human service professional, I will always attempt to seek out if abuse is taking place, whether it's a child or an adult. I think that the human service environments can be affected if we are not being educated on how to prevent abuse. The environment can definitely be affected if we are not helping the people who we initially and ethically signed over to help. So in the future, I'm hoping that myself and other human service professionals are able to advocate and keep elderly people safe. Let's team together to end elderly abuse.